Good afternoon, everyone, and welcome to Medical Grand Rounds. Just a reminder before we get started that you will be receiving a survey at the end of the rounds. We ask you to please fill this out, and this will let us know that you were present at today's rounds. We have a special presentation today. We have several people talking to us, and this is a primer to what's going to be the future Schwartz Rounds, which comes to us courtesy of the Wellness Task Force. And of course, this is led by our Associate Chair of Wellness, Dr. Natalie Dayan. Dr. Dayan is an Associate Professor of Medicine at the MUHC and McGill, and is a specialist in general internal medicine. She's a clinician scientist involved at the Clinical Outcomes Research Evaluation Center at the RI. She holds a Fondation de Québec Recherche en Santé, FRQS, Chercheur Boursier Clinicien Award Junior 2, and an early career professorship for women's health and brain health from McGill University and the Heart and Stroke Foundation of Canada. Her research work, which is funded by CIHR and Heart and Stroke, focuses on maternal morbidity and long-term women's health. As the Associate Chair of Wellness, Dr. Dayan has led a wellness task force who has worked towards the launch of the Schwartz Rounds, and she'll be telling us about that today. Other speakers who will be joining us are Matthew Park, who started his career working within adult mental health and crisis intervention in the community. He joined the Montreal Children's Hospital in 2007, has been working as a pediatric social worker for the Pediatric Intensive Care Unit for the last 13 years. He's a founding member and facilitator of the MCH Schwartz Center Rounds from its inception as of this year, and co-chair of these rounds. We also have Amanda Cervantes. Amanda is a faculty lecturer at the Ingram School of Nursing, McGill University, with a focus on children's nursing and critical care. She started her nursing career in the Pediatric Intensive Care Unit at the Montreal Children's, where she first became involved in the Schwartz Center Rounds program. And finally, Dr. Patricia Dobkin. Dr. Dobkin is Associate Professor in the Department of Medicine affiliated with McGill programs in whole person care. She has been interested in mind-body medicine since 1980. She's a clinical psychologist, and she provides treatment for patients with chronic illness. For the past 16 years, she has extended her work to include mindful medical practice programs and physician well-being workshops. She's a member of the Department of Medicine Wellness Task Force and will facilitate some of the Schwartz Rounds this year. Having said all that, so we have all our speakers. I'm going to hand the floor. Natalie, you're going to get started. Thank you very much to all of you for being here today. Natalie, the floor is yours.
Thank you so much, Nadia, for that introduction and for the invitation to speak today about the launch of Schwartz Center Rounds in the Department of Medicine. So the topic of today's rounds follows very nicely from last week's MUHC Medical Grand Rounds, given by Drs. Eidelman and Moss, about the importance of fostering a culture of wellness for our learners in the Faculty of Medicine and Health Sciences. In his talk, Dean Eidelman alluded briefly to issues surrounding faculty well-being, which of course is a key factor in the ability to create a positive learning environment. So today, I think we're now shifting from issues of learner wellness to issues of faculty wellness, and that's in that context that I'm discussing Schwartz Center Rounds with you today. In terms of disclosures and conflict of interest, all four speakers have none to declare relevant to today's talk. So there are 4 learning objectives that were circulated, and I will discuss the first 2, which are to describe the objectives of Schwartz Rounds and familiarize with plans for the launch and rollout of these rounds within the Department of Medicine. I will then hand over to our colleagues at the Montreal Children's Hospital, Amanda and Matthew, who will share with us the experience at the Montreal Children's Hospital with implementing these rounds. So really valuable on the ground experience with how this went down just next door. And then along to Dr. Dobkin, who will be sharing a real-time Schwartz Rounds activity just for us to kind of get our feet wet and see a little bit of what it's like. So this is really an experiential type of rounds. Okay, so I wanted to first, before actually describing what Schwartz Rounds is, I wanted to first discuss the evolution of both professional and organizational concepts of wellness in medicine. And this figure that you see here is courtesy of an article by Dr. Schanefeld at Stanford University, who is a leading expert in wellness in medicine. And he published this in Mayo Clinic Proceedings. And it's basically about shifting from wellness 1.0 to wellness 2.0. And what does that mean? So if you can see here, what are some of the professional characteristics and mindsets he describes in these three eras of physician well-being. And I think we can replace the word physician with healthcare worker or academic. And in sort of the older, more traditional model, the era of so-called distress was an era where physicians were regarded like deities. They were perfect. There were no limits on their work. Oftentimes the physicians, if we're talking about sort of 100 years ago or 50 years ago, mostly it was a male-dominated field. They often had female partners at home, taking care of the home front. So there were really no limits on work, and also no self-care, a lot of isolation and a focus on performance. Fast forward to Wellbeing 1.0, which really coincides a lot with the pandemic, where we were regarded as heroes, healthcare heroes. So there were hero-like qualities, no longer deities, but heroes. And it was recognized that wellness is important, and so was work-life balance, this sort of unattainable but important ideal to be striving for. Wellness, however, was really the onus of wellness was on the physician themselves. You know, we have to develop and foster resilience and practice mindfulness, and it's up to us to be well so that we could perform at our best. And then that led to a lot of frustration, right? Because, you know, it's yet one other skill for us that was sort of a lot of pressure for us to be well so that we can work in an often dysfunctional and resource-strained environment. Wellbeing 2.0, and perhaps we're not there yet, but this is what, you know, the ideal is again, you can see that, you know, physicians are no longer deities or heroes, but just humans with challenges and strengths and then areas of growth, just like anybody. And there is more of this openness, vulnerability, and a growth mindset. And rather than focus on work-life balance, again, this unachievable goal, there's this focus on work-life integration. And an example of that would be, you know, really working towards a wellness culture in which the work environment really accommodates people at all different stages and accommodates their family circumstances. For example, having breastfeeding rooms, for example, having a daycare on site. So that's more like work-life integration and fostering a sense of community, meaning, and purpose. So these are the professional characteristics. And along with that, you can see here the evolution of organizational characteristics. So in the era of distress, there was really a lack of awareness of the importance of of healthcare worker wellness, more focus on institutional needs rather than individual needs, the environment being more rigid, ignoring distress, ignoring substance use, ignoring mistreatment, and ignorance of the economic impact of poor wellness in healthcare workers. Again, Wellbeing 1.0 reflects some progress from the era of distress in which there is awareness and there's a focus on patient needs, but that there's an importance of, you know, recognizing the well-being of healthcare workers as well. More like, but focused on treating distress, carrots and sticks sort of approach, blaming individuals for their own lack of wellness. However, recognizing the return on investment. Unfortunately, you could see that there is in Wellbeing 1.0 an adversarial relationship between physicians and administrators because physicians feel like they really can't be well if the work environment and the culture in which they work is not well. Whereas Wellbeing 2.0, as you can see, there's a collaboration from healthcare workers and the administration or environment in which they work. There's a collaboration and a shared responsibility in addition to aligned autonomy. So really, the idea is that we are working towards Wellbeing 2.0, and in order for us to all, for this to work, we all really need to be on the same page and really understand where we're coming from and where we're going. So I'm describing this to you so that you can understand where Schwartz Center Rounds really would fit into the broader picture. So now I'll describe to you a little bit about the Department of Medicine Wellness Task Force. You may have heard about it either in the annual newsletter or in the annual report or in the weekly newsletter. When I started in my role as Associate Chair of Wellness, I developed a wellness task force and a term of reference for the wellness task force. The mandate of this task force was to represent the wellness needs of the members of the Department of Medicine across all McGill sites and campuses, to facilitate access to existing resources and programs, to enhance education and communication through existing channels, and to develop, in some situations, new programs and tools to support faculty well-being. And so as you can see through the members here, we have both MD and non-MD members across all the different sites that the hospital sites that comprise the McGill Department of Medicine, with the idea that there's representation of all the different wellness challenges and needs at all the different sites, that that there may be some unique needs at different sites. So we do meet about every 3 months, and we discuss some of these priorities and this mandate. So within these meetings, we really developed a sort of well center. We call, so of course it's a virtual center without any geographic boundaries, but in terms of our priorities that we have been focusing on as a group are really divided into this pyramid approach, in which the first year we were focused on so-called primary prevention, sort of ensuring access to a well environment for all through communication and dissemination of information and activities and concepts, the mentorship program that many of you are now very familiar with, and other sort of activities such as the Move or Step Challenge with residents, social activities such as the recent McGill-wide Department of Medicine soiree, and of course we support the already existing care workshop put forth by Tom Hutchinson and colleagues, including Dr. Dobkin, as part of McGill Whole Person Care. And then secondary prevention, so-called, we called it secondary prevention because, in this category are activities and programs that are focused on, discussing challenges in the workplace that are either societal, so how to deal with racism and other forms of discrimination, or difficulties with patient interactions with our colleagues or with our learners. And so really, sort of understanding that there are some challenges and discussing those together in a safe space that's facilitated. And then crisis management for our colleagues in distress. So in year 2, we are really focusing on this piece, which is the Schwartz Rounds. So what are Schwartz Rounds? What is the Schwartz Center? So the Schwartz Center is a US-based organization that trains and certifies centers to run basically these rounds and other types of rounds or facilitated discussion. It takes place in hundreds of organizations throughout the US, Canada, the UK, Ireland, and Australia. The mission, as you can see here, is to put compassion at the heart of healthcare through programs, education, and advocacy. And their vision is to have a world where all who seek and provide healthcare experience compassion. So Schwartz Rounds, the goals of Schwartz Rounds are really, these are formal rounds. There's a unique and specific structure, and there's a period of training and facilitation in order to be able to provide these rounds. And the goals are to improve teamwork, communication, and appreciation of our colleagues in different disciplines, decrease stress and isolation, so enhance collaboration and a feeling of community and belonging, and increase the insight into the social and emotional aspects of our work. So it's much easier to talk about what Schwartz Center rounds are not, rather than what Schwartz Center rounds are. So what they are not is they are not grant rounds. So we're not sort of sitting passively and increasing our sort of CME in a specific kind of content. They are not a debriefing, and it's not sort of morbidity and mortality rounds in which there is a problem and that we work together to find a solution. So it's not really a problem focused or solution oriented type of rounds. It's not supervised, and there's no forced participation. So really participation is voluntary in these rounds, of course. So how are we going to roll this out in the McGill Department of Medicine? We'll be hearing shortly about how this rolled out at the Montreal Children's Hospital. But essentially, it will be, the goal is for this to be multidisciplinary rounds that will take place virtually, at least for this year, at all the different sites. So at the Jewish General Hospital, St. Mary's, and MUHC, during regularly scheduled medical grand rounds. So during the regularly scheduled grand rounds for each of these sites, and we'll be rotating through, and I'll share with you the schedule. And the reason we chose to do this is because nobody needs another meeting to put into their calendar. And these are meetings that are already well known and well attended by all of you. So I thank the organizers of all the different grand rounds for giving us some time slots within each of these hospital medical grand rounds. So all healthcare workers and staff are invited, and importantly, if you're at the Jewish General Hospital, you could join the St. Mary's Schwartz Rounds if that topic isn't, of interest to you, or the MUHC Grand Rounds, and so on. So, and all healthcare workers and staff are invited, as is the case with most medical Grand Rounds. This is the Schwartz Committee. So it essentially is, the Wellness Task Force, but I wanted to make particular mention of Emily Lee Churchill-Smith, who will be the coordinator lead, trained facilitators, so Mark Smilovich from the Department of Medicine, as well as Dr. Dobkin. And then in addition to members of the Wellness Task Force on the committee are, again, Mark Smilovich, Tom Hutchinson, and Gail McEachern. And of course, with the occasional attendance by Matthew Park and Amanda Cervantes, who have been instrumental in helping us get this off the ground. So in terms of the schedule events, we will, obviously share this in all of our other channels, but the first one will occur at the Jewish General Hospital during their grand rounds, which I believe is Mondays at 12:30. But again, the exact time will be circulated on November 28th. And the topic is the Great Resignation, Why I Am Still Here. And we're in the process of getting an excellent panel together for you. The other two rounds that are so far scheduled for the remainder of this academic year are in February and in May, as you can see. And so I'd like to now take this opportunity to again thank the Matthew and Amanda as part of the Montreal Children's Hospital Schwartz Rounds. I first learned about this when I was actually attending a faculty development session, and a member of the Department of Pediatrics mentioned Schwartz Rounds. And so I became curious, and then I asked to be invited to the MCH Schwartz Rounds, and I attended a couple of them, and I was really impressed by the attendance and the power of this type of activity and this type of facilitated discussion. So without further ado, I will now turn over the mic to Matthew, who will be discussing Schwartz Rounds at the MCH.
Thank you very much, Dr. Dayan and Dr. Dobkin, for this opportunity to share our experience. Amanda and I are really looking forward to this. Next slide, please. Our hope today, or our goals in terms, is to be able to describe a little bit about the Schwartz Center rounds here at the Montreal Children's Hospital, to discuss the implementation and how it was received here, and then to kind of look at where we're headed in the future and what we have in terms of our goals. Next slide, please.
So this photo is just a sense of our rounds. This photo was our last in-person rounds that we were able to do before the pandemic. And it's special for a couple of different reasons to us. It is the first hospital-wide rounds, which we'll speak a little bit about in a few slides. And for us as well, you can see that engagement. You can see us all in the same room together, which is something we haven't been able to do in a while. It's also special to us because it is Dr. Ronald Gottesman was one of our panelists that day. So it's special for many reasons. Next slide, please.
Schwartz Center rounds here at the MGill Children's wouldn't be possible without our current, past, and present committee members. We're well represented from a multidisciplinary aspect, including allied health, nursing, medicine, and senior management. And really, our committee is key. It helps for planning topics, finding the appropriate panelists, and really it is a team effort. Next slide. So our Schwartz Center round started as a unit-based rounds, not like what happens in most other hospital settings, where it is a hospital-based rounds. The context was 2015. We had just moved the pediatric intensive care from the legacy site to the Glen. The PICU really had no time to regroup. We had difficult cases keep arriving. The sense of fatigue was palpable, and there was a need for a systematic pre-planned forum to discuss and address moral distress. This was a bit of a culture shift. We adapted our Schwartz Care rounds to the PICU reality, building upon the team that we had already had to create a safe space to share and connect. So we did our rounds for quite some time from 2015 to 2019. And at that point, we had built quite a strong following and decided that we would take what we had learned so far and open it up to the rest of the MCH community because we thought everyone could benefit from this. A little bit later, we'll talk our transition in 2020 to more the virtual reality that we had no choice to cross. Next slide, please. So Schwartz Center rounds really happen every 6 to 8 weeks here at the Children's. They're an hour-long session. They start with a panelist, so anywhere between 3 to 4 panelists from a multidisciplinary background. So we often include a physician, nursing, allied health. We've had a housekeeper, an interpreter. Really, we try to make it as multidisciplinary as possible. And these panelists share their point of view with regards to a specific topic, their experience and their emotions. And then this opens up to a larger discussion that's facilitated by both myself and Amanda. Next slide, please. So over the last 7 years that we've been doing this, we've covered quite a few topics. We've highlighted a few here for you. I think a few that I'd like to draw attention to would be For the Love of Peds and why we work in pediatrics. This was one of the sessions that we had a housekeeper be able to be on the panel. And if you've been to the Children's and you've seen this housekeeper, when we were trying to plan the specific rounds, his name came up predominantly. Often he would be seen driving the Zamboni machine and suddenly letting go and pretending like he was crashing into the child just to make them laugh while they're waiting for their clinic appointment. Into this past June, we also redid this specific topic and was able to collaborate with the MGill Children's Hospital Foundation with one of their programs that they have, which is called the Champion PIN program, which highlights really just the commitment and the enthusiasm that people have for pediatrics. Another one that's always great in a hospital setting that we've done on 2 occasions as well is My First Code. I think it's really striking to hear varied professionals from different backgrounds, from different levels of years of experience, be able to share their first code. What really stands out is how it stays with you, whether it be the sights, the sounds, what you said, and hearing somebody who's had 30 years experience talk about their first code like it just happened yesterday is quite striking. And we would not be able to have Schwartz rounds without actually addressing some of the COVID topics that came up in the last 2.5 years. One specific one that I remember fondly is Building Bridges, a new collaboration during the pandemic. And this really did highlight the collaboration that we had with the RVH and also the Children's in terms of caring for adult patients here in our pediatric intensive care. Next slide.
The focus of our rounds has generally been doing the rounds, building that community. But with that, we have been able to kind of take our work out into the world and present and kind of look at our work also from a research lens as well. Next slide, please. So we presented this poster at the World Federation of Pediatric Intensive and Critical Care. This was supposed to be in-person and pivoted virtually, but we were able to present the poster. Looking at this slide, it was really about our work specifically in the PICU. So this was looking at our the post-participation surveys, different conversations that we had, and looked at really what was the reception to our rounds. And this is looking over several years as well in terms of some of this data. What was really striking to us is that there was positive reception. They seemed well received. You can see in terms of some of the different yes/no indicators here that were generally positive. And for us, ultimately, the goal has always been to bring the community together, to understand each other in our roles and our interprofessional lives a little bit better. And what was striking as well is that looking at the comments on our surveys, we did see that we were meeting our objective and our goal, which is really gave us that confidence that we needed as we were starting to think about going hospital wide. So that's really what this gave us. Next slide, please. As a part of the transition that we have all gone through since March of 2020, we looked as well at the feasibility of our virtual rounds. So in April, May, and June of 2020, we did the series we call, unfortunately, the COVID rounds, really looking at whether or not this virtual world was feasible for the Schwartz Center rounds, really thinking about how that transition worked and what would work and what weren't, all of our worries kind of wrapped into this transition, really thinking that that coming together in community, was it feasible in the Zoom world? So we have presented pieces of this research at the Canadian Association of Critical Care Nursing. We have presented as well at the Schwartz Center, the Compassionate Care and Action Conference. And we've done this at several grand rounds, but notably on the adult side was the Radiation Oncology grand rounds in the fall. Next slide, please. So when we looked at transitioning to online, we knew that our colleagues needed it. We had a sense that this was something that was needed in the hospital. And we had also known that we had built capacity. So we had built capacity through our Schwartz Committee as well as through the community that we had built up until now. And through some of our work in the academic world, that transition to the Zoom that we were all doing in the academic world, we thought we could do that in this virtual world as well. And we in terms of, like, again, our surveying is not our primary focus, but it was something that we wanted to look at. And really what was important to us, again, was highlighted that idea of today's discussion gave me new insights into the perspectives and experiences of our coworkers. And that really has always been at least one of our main goals of doing the rounds. And what was striking to us as well is we asked the question if they were planned to attend again. And again, we got a kind of overwhelming yes. So not only were we able to transition into the virtual world, but in some ways we built a community stronger through our virtual Zoom rounds. Next slide, please.
So for the last 7 years, we definitely have some lessons learned. I think the things that I'd like to point out is the using of our committee as a pulse for what's going on within our community. Knowing what topic we need to do, if we should be changing things, what's needed based on the different sectors of people who attend or are part of our committee. And then I think another takeaway for us is the panelist and how important that is in terms of really setting the point of where we're going to start our discussion and setting up for that richness that then follows. And what we've learned also significantly is the importance of preparation and preparing our panelists. I think this is unlike any other forum that we have within the hospital. We're asking panelists to do something that they're not used to doing. It's scary. They have to talk about their own perceptions, their own emotions, and it requires trust. So spending that extra time with the facilitators, with the panelists to prepare them for rounds has really paid off, and I think has really helped our success in terms of our Schwartz Care rounds here at the Children's. Next slide.
So moving forward, we hope we're continuing to expand not only the units that we have committee members from, but also our panelists, the different parts of the hospital that maybe we haven't heard from, making sure that we're looking at all of those interprofessional pieces as well. We have always been lucky, and we continue to really be lucky with the amount of hospital leadership that supports our work, and we continue to expand that through our committee work as well. And we are looking at integrating more intentionally the research potential as well as collaboration around those pieces. I think for all of us, our major accomplishment has been that we have built our Schwartz Center rounds into the culture of the Children's. We have legitimized that relational focus, which took some time to get us to. So we really are proud of that work that has come together. And I think for all of us, we have very much been just those happy hallway conversations where somebody will come to us and say, this is happening on the unit, or we're struggling with these things. We think this should be a Schwartz. And that to us is really a sign that we are a part of we're a part of the fabric of the hospital, and we're very proud of that. Our upcoming Schwartz Center rounds are November 7th with To Err is Human. This is one that we've done in the past, and it brings together also different, we try with our panel to bring together different levels of experience as well as professions together to just all have that moment where we remember when something went wrong. And we are on December 12th looking at the hidden talents behind the professional. And this is a community building Schwartz Center rounds, which is also one of our main goals. Thank you. Next slide.
Thank you very much, Amanda and Matthew. So, hopefully you've gotten a bit of a flavor of what Schwartz Rounds is like on the ground, or what it was like to develop that at the Children's, and how it became integrated into the culture of the Children's. And I've described a little bit about how we plan to roll that out within the Department of Medicine, which is a little bit unique in that we have 3 different sites that we will be hosting the Schwartz Rounds at through medical grand rounds. And so I think now would be a perfect time to have a better sense through a video that Dr. Dobkin will show us, and then start to discuss a little bit what it's like sort of from an experiential standpoint. So Patricia, on to you.
So Emily, you can show the video now, please. So this might take a moment to switch from slides to video, so bear with us, please.
Can you see the video?
Yeah, we can, Emily.
Mass General. I remember the energy that was in the room, and I remember how nervous people were. Could this work? And we had several rounds that were, I thought, spectacular. And then I had the pleasure of going to St. Vincent's Hospital in Worcester. Very different in culture from the MGH, a smaller hospital. When I walked in and saw Schwartz Rounds, and I saw the same energy, the same desire, and I saw how much the mission of the Schwartz Center resonated with the staff at St. Vincent's. That day, we knew that there was something special about the Schwartz Center Rounds, and we knew that the Schwartz Center Rounds would translate to hospitals throughout the United States, and now we're finding out throughout the world.
People discovering that they're not alone. Everybody puts on a good front. Everybody looks like they're doing okay, and nobody really talks about what's a problem. You can feel awfully alone if you know you've made a mistake. or you know you've had trouble with something, and nobody else is talking about it. You know, the logical conclusion is you're the only one, and that can be very isolating.
Schwartz Rounds, at the very least, reminds people there are people out there who get what you're going through. And so building a sense of community was one very powerful message.
I think that the rounds really provide that unique opportunity for caregivers to come together to talk not about what they did with a patient or the outcome of a test result or treatment with a patient, but really to focus on how you feel doing what you do day in and day out. And in that way, I'm not aware of any other venue or program that can bring a lot of different areas and subspecialties in healthcare together, sitting in the same room, sitting elbow to elbow, where the hierarchy of a division chief and a hospital orderly is broken down. Everybody's on the same playing field, same level, talking about the human side of what they do on a daily basis.
So Schwartz gives this great opportunity to talk about pretty much, as we say, the human side of medicine. So the things that keep you up at night, the things that you connect with your patients, the moral distress that people sometimes experience.
To be able to talk about certain aspects of caring for somebody in an open forum like that, where somebody else is willing to listen and then give you feedback about what you said, that I remember distinctly as being very, very special.
It ended up that one of their fellows told a story that was quite emotional, and it turned out to be a really powerful Schwartz Rounds.
It was a rounds about a very human, emotional side of a young cancer patient. She died from a complication from the treatment, not the disease. A very senior oncologist, a colleague of mine, standing in the back of the room, started to talk about the same thing that happened to him. A patient of his had passed away, and he was actually tearing up and crying. I later learned that was an experience that happened to him over 10 years ago. Yet it was still something in the moment. And it really, that rounds helped me understand that the connection between a patient and a caregiver is meaningful, and I don't think it's ever lost.
We have to realize we're all going to get sick. We're all going to need health care. People in our families are going to need it. And at that point, people are going to realize, you know, my doctor is stressed out, my nurse is stressed out, my social worker is stressed out. We need to take care of them. We need to take care of the patients. We need to do all of that. And we're going to have to change something.
And I think Ken's vision is still true today, that if we don't prioritize or value the patient-caregiver relationship, it can still be lost.
The expectations that people have of their physicians is just really tough, especially because in a profession where you're dealing with life and death issues and so forth. You've read the statistics on physician burnout. That's terrible. They should have a place where they can just be and can just be without judgment and can be without criticism.
I mean, we're definitely filling a gap that no one's thinking about. I think people neglect the idea that caregivers have feelings too.
At the end of the day, patients care about the connection they have with their doctors, and they value that relationship. And that is very sustaining to healthcare professionals. And I think that's why I don't worry that healthcare will ever go too astray, because it's the connection with patients, and what Ken wrote about is really at the center of what makes medicine unique and special.